Well, hello and welcome everyone to Good Mental Health. This is Disorder Dialogue Series 2022. So, today in this episode, wherein we have reached episode number 5, which is DD5, and that is personality disorder. So, this is what I'm going to talk about. And before I shall begin, I would like to start with my introduction. So many of you do know me who I am, but for those who are new to this platform, Good Mental Health, so I'm the founder director of Good Mental Health, rehabilitation psychologist, a professional adoption counselor, international radio show host, life coach, and a podcaster. So my name is Anuradha. So I'm gonna really be here for some time, wherein I am going to explain you the in-depth, the detailed, overview of personality disorder today. So maybe any one of you do know, but those who are not aware of what is a personality disorder, I want to tell you that when we talk about personality disorder, there are certain categorizations, yeah, and the types which I'm going to talk about. Also, I'm going to tell you about all the detailed, symptom of each type, and that is what we will carry forward in this DD5 episode, in which, after the types, I will be discussing a case. At the end, I will let you know that what are the suitable and the right interventions for DD, for personality disorder, right? So, moving on to firstly having an understanding of what is personality disorder. So, today I'll try speaking two languages, like I will take a blend of Hindi as well. पूरी कोशिश करूंगी that I can explain you in Hindi as well, because that is the demand of many people. So talking with starting with the personality disorder. So when I have to explain what is a personality disorder, definitely it is a mental health disorder, right? जिसमें कि हमारे पास एक rigid unhealthy pattern of thinking है, very rigid functioning hai, very rigid behavior hai. When somebody is experiencing personality disorder, which means the person, with personality disorder definitely have a very rigid behavior, thinking, and functioning. So the person, when somebody have this disorder, उनको बहुत ज़्यादा trouble होता है to perceive with the situations, with the people, and they can't really relate themselves easily with people, also with the situations. So उसके कारण उनके लाइफ में बहुत सारे significant problems आते हैं, जो limitations कर देते हैं उनके relationship में, social activities में, also in their work performance, also the output of work, and their schooling or their institutionalization, right? In terms of education. And this is basically a disorder, personality disorder, जो कि begin कब होता है? At the age of teenage and or early adulthood. So this is what is something that you need to understand. Moving on to explaining the types of personality, I would like to tell you that, as I mentioned, that there are three categorization in which there are certain types, starting with eccentric, then dramatic, then anxious. So when we talk about eccentric, that is a very unusual type of a personality which has certain types, and dramatic, it name explains everything. And anxious also, when we talk about anxious personality disorder, which is very much in which the person has a very anxious behavior, anxious personality. So moving further, I'm going to start with the eccentric, which is the first one. So I've taken up randomly. So the eccentric personality is something in which you can see the people are very peculiar, very, often appear very odd, right? Because in their personality, you can see this thing. So when we talk about eccentric, there are types. Number one is paranoid. Paranoid is basically a hallmark word that has been linked with this type of a personality. Why? Because in this, the people who are suffering with personality, paranoid personality disorder, उनको बहुत ही constant, mistrust रहता है लोगों के ऊपर. They can't trust people easily. They remain suspicious about others. They just can't trust them. That is how they keep on suspecting that they might not be having good intentions towards them. Maybe people can harm them, pull them down, they can demean them, they can threaten them. That is why they remain very paranoid with people, with anyone when they have to interact. Because of this, that is the thing they have into their personality. So how will we get to know that somebody is experiencing, or this kind of a personality disorder, which is paranoid? So I'm going to share the symptoms. Its symptoms are in which the person have continuously believe that others have hidden motives behind. जहाँ पे लोगों को ऐसा लगता है कि when somebody is suffering with this, उनको लगेगा कि अगला person जो है वो मुझे harm पहुंचा सकता है, उसका intention गलत होगा, या he is not a good person, and maybe not a loyal person. उनको लोगों के साथ काम करने में डिफिकल्टी आएगी. Another symptom is वो hyper sensitive रहते हैं towards any criticism. Maybe the criticism is for their good, but they can't take or handle criticism easily. Another symptom is that वो बहुत जल्दी hostile हो जाते हैं, aggressive हो जाते हैं, अपने आप को डिटैच फील करते हैं, सोशली आइसोलेट करके रखते हैं. दे डोंट वांट टू बी attached with people, or when there is a public appearance, they try to stay very calm, and they don't like interacting. They try to be socially isolated. बहुत ही argumentative होते हैं, defensive होते हैं all the time, as if they are ready to be very defensive. और उनको ट्रबल रहता है to see that how people are going to take them, why people have a trouble with them. उनके बिहेवियर को लेकर ही उनके मन में कंसर्न्स रहते हैं, और उनको बहुत ज़्यादा ट्रबल रहता है टू रिलैक्स, राइट? So these are the symptoms. That is how you can suspect if somebody is going or experiencing paranoid personality disorder. Moving on to the next type, which is schizoid personality. When we talk about schizoid, they are when somebody has this disorder, they are distant, they are very detached from everyone, and they show very indifferent behavior. उनका जो social relationship भी होता है वो भी बहुत indifferent होता है. They don't get along with people well because of they have a kind of personality in them जो कि जिसको कहते हैं कि दे आर कम्प्लीटली लोनर्स. वो अकेले रहना प्रेफर करते हैं, सॉलिट्यूड एक्टिविटीज, मतलब काम भी अकेले में ही करना पसंद करते हैं, अकेले ही रहना पसंद करते हैं. रेयरली दे एक्सप्रेस देयर इमोशंस. सो उनके कोई भी इमोशनल नीड्स हैं, दे कैन नॉट एक्सप्रेस इट सो वेल. So now the symptoms of schizoid personality are that they are loners. I told you that they prefer staying alone. If somebody is really staying alone for a longer time, and if you experience that the person doesn't get along well, which means कि वो उसको ये symptom अगर है तो which means the person is experiencing schizoid personality type. Okay, so and they don't enjoy relationship, rather I can say close relationship किसी के साथ उनको पसंद नहीं है. उनको हमेशा उन पे मिसट्रस्ट रहेगा, डिस्टेंट ही रहेंगे वो. उनको जो सेक्सुअल रिलेशनशिप है उसमें इंटरेस्ट नहीं रहता है, नहीं होता है. एंड दे कांट एक्सपीरियंस एनी काइंड ऑफ अ प्लेजर इन देयर लाइफ, जिसमें कुछ एक बेटरमेंट और प्लेजर हो, दैट दे कांट एक्सपीरियंस बिकॉज ऑफ द पर्सनालिटी डिसऑर्डर दैट दे आर एक्सपीरियंसिंग. उनको डिफिकल्टी होती है अपने इमोशंस को एक्सप्रेस करना, अपने इमोशंस या सिचुएशंस को लेके रिएक्ट करना. दे फाइंड इट वेरी डिफिकल्ट. And they are humorless. You can't expect a joke from a person who is experiencing personality disorder. So when you find somebody that who are humorless, not necessary that they are experiencing a personality disorder, but if this is also one of the symptoms that they can't really express anything in terms of humor, right? इमोशनली बहुत ही कोल्ड होते हैं, किसी के साथ कोई अटैचमेंट नहीं होता है, वो बिल्कुल ही मोटिवेशंस और गोल्स उनकी लाइफ में एग्जिस्ट ही नहीं करते हैं. दे डोंट रिएक्ट टू एनी काइंड ऑफ अ प्रेज, बी इट क्रिटिकल रिमार्क्स फ्रॉम फॉर देम, राइट, from anyone else, right? So they don't really react to that because they don't know how to do that, because of they are into a personality type wherein they can't take it easily. So the next type of an eccentric first category, it's the third type, which is Schizotypal personality disorder. And this is again a very unusual, in which the person has a very unusual thinking pattern. इसमें उनका appearance भी बहुत different होता है, और people with schizotypal personality जो होते हैं उनके odd beliefs होते हैं. वो हमेशा superstitious बातें ही करेंगे. You will see them that they are really talking something which is really not very normal. So they have very superstitious thinking or behavior, and their appearance will show that they are schizotypal. So talking about their symptoms, what are their symptoms? How will you get to know that the person is suffering from schizotypal? They dress up differently, they speak differently, everything is very unusual and odd in them. They are very paranoid, very suspicious. They become very uncomfortable and anxious when there is a social situation. So due to their distrust of towards others, they can't trust anyone easily. That is why they become uncomfortable and very anxious जब भी उनको social situations या social gatherings में जाना है. उनके few friends होते हैं and they are mostly comfortable, not really so much comfortable, but they remain within the family people, but not extra people, maybe as friends or somebody else in the community. They have very few people in their contacts, and they are very uncomfortable with the intimacy, and they tend to misinterpret reality. उनको reality को हमेशा ही गलत ही लगता है, distorted perceptions होते हैं, और जैसे कि उनको कुछ भी चीज़ों को लेके ऐसा लगता है कि everything is making noises, and there are certain voices that they can hear. Okay. And the other symptoms are they have odd beliefs, as I mentioned, that they remain superstitious, and उनको बहुत ही awkward से belief system होता है जिसमें कि उनको ऐसे लगता है कि there is some magical things or powers going around. वो अपने आप में ही involved रहते हैं, और उनकी जो thinking है, thinking of themselves, they actually realize that it is little psychic. So वो preoccupied रहते हैं fantasies में, daydreaming में. They tend to be stiff and awkward when relating to others. They come across as emotionally distant, very aloof रहना चाहते हैं, emotionally भी लोगों से दूर रहना चाहते हैं, और बहुत ही cold people होते हैं. They don't find comfort talking to anyone, and they are very emotionally cold. They can't even feel anyone's emotions as well. So बहुत ही limited emotional response देते हैं. Sometimes you will see them as totally without any response, without any expression on their face, as if they are totally flat. Okay. So moving on to the next type, which is the next category, which is dramatic personality disorders. So when we are talking about dramatic, another category, which already expresses a lot, because here dramatization, the people with a lot of different behavior and personality, will come into your mind. So that is absolutely true when we talk about dramatic, which means they have intense, very unstable emotion. उनके जो distorted self image भी उनका distorted है, वो अपने लिए भी कुछ इतना clear नहीं सोच सकते हैं. So impulsively ही behave करते हैं. So इसका जो first type है, that is what I'll begin with, antisocial personality disorder. So when I am talking about antisocial, which means people consider them as psychopath or sociopath. Why? Because ये जो disorder है, that has been characterized by rash, irresponsible, and very aggressive behavior. So obviously, when somebody is really, really very rash, very irresponsible, they have very aggressive, agile behavior, और किसी को रिगार्ड नहीं करना है, they always keep on disregarding people, their view, and there's they don't even listen to the society rules, so they always disregard all of that. So that is how they are called as sociopath or psychopath. So people with this disorder always, often commit serious crimes. You will see that जो antisocial behavior होगा, जो antisocial type of personality होगी, वो they will not do anything which is good, which is very normal. They will do abnormal things, very serious type of crimes. They even don't have regrets on what they do. So जो वो life में करते हैं उसके लिए भी उनको कोई regrets नहीं होते हैं, which is why they are called psychopath or sociopath. This is a disorder which need attention, which need a professional intervention. So moving on to the symptom of antisocial, when we are talking about psychopath or sociopath, the antisocial personality type, what are the symptoms? The symptoms of they repeatedly perform very unlawful activities which is not acceptable by the society. So जब वो ऐसे काम करेंगे जो कि severe things हैं, that can be related to not following a law. सो वो सोसाइटी के लिए हार्मफुल चीज़ ही होती है, राइट? दिस इज़ वन ऑफ द सिम्टम। लोगों से झूठ बोलना अपने प्रॉफिट के लिए, अपने प्लेजर के लिए, दैट इज़ व्हाट इज़ अनदर सिम्टम। बहुत ही इम्पल्सिवली एक्ट करना, रेपिटेडली फिजिकली, फिजिकल फाइट्स में, फिजिकल असॉल्ट में इन्वॉल्व हो जाते हैं, डिसरिगार्ड करते हैं सेफ्टी अपनी भी और लोगों की भी। दे डोंट केयर अबाउट देमसेल्फ एज वेल एज फॉर अदर्स, डेफिनेटली दे डोंट केयर। वो बहुत ही रिस्पॉन्सिबल हैं काम पे भी और फाइनेंशियल ऑब्लिगेशंस के लिए भी। या सो उनको कोई भी रिग्रेट्स नहीं होते हैं व्हेन दे मिसट्रीट अदर्स। सो दिस दीज आर द सिम्पटम्स of antisocial personality disorder. Moving on to the another type, which is borderline personality. When we talk about borderline personality, these people are marked with very unstable mood. उन्हें पुअर सेल्फ इमेज होती है, बहुत ही chaotic relationships होते हैं उनके, not so sober, not so nice. They remain in a very much chaotic relationship. इम्पल्सिव बिहेवियर होता है, सच एज कि उनको they need the immediate gratification from any sexual activity, or either they involve themselves in substance abuse. They spend a lot and they do a reckless driving, which can be dangerous to others on the road, as well as for them as well, right? So ye borderline personality is also very serious type of a personality disorder. And each one, the types which I'm sharing with you about personality disorder, it is really something that need professional attention, that should not be left untreated. And moving on to the symptoms of borderline personality, as I told you, that they can be self-harming for themselves, as well as they are dangerous for the society. Self harm, like they can cut themselves and they don't feel the pain. They have a pattern of very intense, very unstable relationship, either with family, either with friends, or with any significant person or the loved ones. So they don't care, they have no emotional attachments. वो एफर्ट्स बहुत ज़्यादा लगाते हैं कि उनको कोई अबैंडन ना कर दे लाइफ में. दैट इज हाउ दे कीप ऑन डूइंग समथिंग. They rush into the relationship, try to get into the physical relationship so that nobody can abandon them, leave them. This is their fear, and which is a symptom of borderline personality disorder. Another is they remain very unstable, distorted self image होता है उनको अपने लिए, बहुत ही impulsive behavior होता है उनका, बहुत ही unsafe way से sexual intercourse करते हैं, binge eating बहुत करते हैं, drinking बहुत करते हैं, and reckless driving. They don't care when they drive on the road, which is very reckless, dangerous for themselves as well as for others. So moving on to another symptoms, which is feeling of emptiness. That doesn't go away. They actually feel that they are lonely in life. Their activities, what they do in life, is something जो उनको हमेशा ही एक एम्प्टी फीलिंग देता है, कि एज इफ वो बहुत अकेले हैं लाइफ में. उनको बहुत ट्रबल होती है लोगों को ट्रस्ट करना, और बहुत सारे इरेशनल फियर्स हैं उनके मन में चीज़ों को लेके, और बहुत सारी चीज़ों को लेके, कि पीपल उनको कैसे ले रहे हैं, दुनिया उनको कैसे ले रही है, हाउ दे आर सीइंग देम, जजिंग देम, और मे बी हाउ दे आर लुकिंग एट देम, हाउ दे आर टेकिंग देम. उनको बहुत ही एंगर इश्यूज होते हैं, जो कि इंक्लूड करते हैं बहुत ज़्यादा इरेशनल, बहुत ज़्यादा इंटेंस एंगर, और उनको इश्यूज बहुत सारे आते हैं अपने एंगर को कंट्रोल करने के लिए. वो एंड अनदर थिंग इज दैट they feel disassociated from their own body. They don't feel that they belong to their own body, or their body belongs to them. वो उस चीज़ के साथ relate ही नहीं कर पाते. उनको intense और quick और सडन मूड चेंजेस होते हैं, विच मीन्स मूड स्विंग्स होते रहते हैं. सुसाइडल थॉट्स भी आते हैं, और थ्रेट्स बहुत ज़्यादा उनको उनको लाइफ में फील होती है. So these are the symptoms of borderline personality disorder. Moving on to the another type, which is histronic. So when we talk about histronic, which means melodramatic, so this is also the part of the dramatic personality disorder, melodramatic. which means in here the word itself says a lot. Melodrama, right? So people who create a lot of melodrama, they are with this disorder, they go through a shallow, constantly they want to seek attention of people, or they become very dramatic, possibly sometimes they even behave childish so that they can get attention of other people, or they become overly emotional, somewhat they have to do wherein people can see them, look them, maybe they dress up or do something so that they can come into the eyes of others, which is why they are called melodramatic people. So when they are doing all of these activities, which it can be really uncomfortable for the other person in the community, from family, friends, so people don't take them so nicely. So moving on to the symptoms of melodramatic, which is excessive attention seeker. So when somebody is a melodramatic personality type, which means they want to seek attention, they are very attention seekers, and they engage in all the inappropriate behavior. Why? Because they want to gain praise. उनको praise चाहिए, उनको पूरा एक approval चाहिए लोगों का, जहां वो जाएं जो भी वो करें, वो ऐसे एक्ट करते हैं एज इफ दे वांट टू बी द सेंटर ऑफ अट्रैक्शन, और बहुत अनकंफर्टेबल हो जाते हैं और आउट ऑफ प्लेस फील करते हैं व्हेन दे आर नॉट द सेंटर ऑफ अटेंशन. सो किसी भी जगह में जहाँ पे उनको सेंटर ऑफ अट्रैक्शन नहीं मिलता है, सो दे डोंट फील कंफर्टेबल. सो बहुत ईजिली लोगों से इन्फ्लुएंस भी हो जाते हैं. उनका ऑब्सेसिव फोकस होता है अपनी अपीयरेंस में, अपनी लुक में. व्हाई? बिकॉज दे वांट टू लुक डिफरेंट सो दैट पीपल शुड लुक एट देम. So this is what is one of the major symptom in melodramatic personality. And they believe that relationships are closer, more intimate than they actually are. So they think that being in a relationship is something that can give them something, but they actually are not into very emotional sort of people, so they can't continue with the emotional stability as well. So proactively dressed up hote hain inappropriate sexy way se, as if they want to look very appealing to people, and using one's look and physical appearance to gain attention. As I mentioned, that unka appearance, apna dressing sense unka aisa hoga ki everyone should be looking at them. Maybe if they're looking odd, or maybe not appropriate or appealing for other people, but they look like, they think that they have to look like, somewhat very melodramatic. And rapidly, उनका जो इमोशनल स्टेट है वो शिफ्ट होता रहता है. कभी सेंटर्ड होता है एंड ऑन हाउ इवेंट्स इफेक्ट देम, कभी कभी एकदम से मूड स्विंग की तरह उनको होता है. एंड every event basically that happens into the life, that affect them, they instantly get affected by, if they are not getting what they want, maybe the kind of attention they want from the people, if they don't get it, so वो बहुत ज़्यादा impact हो जाता है उन पे. So already they are experiencing this type of a disorder, and when they don't get what they want, तो वो और impacted हो जाते हैं. Moving on to the last type of the second category, which is narcissist personality disorder. So ये वाले लोग जो होते हैं वो कैरेक्टराइज कैसे होते हैं कि जो कि बहुत ही एग्जैजरेटेड, जिनमें सेंस ऑफ सुपियोरिटी हो रहा है, राइट? दे फील सुपीरियर from everyone else. They think that they have superpowers, they are the best, they are mostly preoccupied with with their own success, with their own power, with their own show off kind of a thing. They think that we are superior from everyone else in this world. So this is the kind of personality in which there is one thing very specific. They remain very preoccupied with their powers, maybe with the exaggerated sense of superiority, right? But at the same time, when they are being preoccupied, their self-esteem get very fragile. Their self-esteem is actually very fragile. If they get impacted so easily, they can be very broken or shaken, right? So it can impact them in terms of their confidence can be lower, and their personality will totally be go to a next level wherein they can face a lot of more things. So people with this disorder are very self-centered. They tend to lack empathy. Unko, they don't know how to be in someone else's shoe. उनको कोई realization नहीं होती है कि किसी का दर्द कैसा है, right? They can't really feel the empathy. एंड कांस्टेंट उनको एडमायरेशन चाहिए, अटेंशन चाहिए लोगों से, दैट इज व्हाट दे नीड इन लाइफ एंड नथिंग एल्स मैटर्स. सो ऐसा टाइप ऑफ पर्सनालिटी के सिम्टम्स के बारे में बात करेंगे. बहुत ही ग्रैंडनेस है उनको चाहिए, बहुत ही सेल्फ इम्पोर्टेंस मिलना चाहिए उनको हर जगह. एंड दे फील दैट यू नो दे कीप ऑन फैंटेसाइजिंग कि यू नो अपनी ही सक्सेस, अपनी ही परफेक्शन, अपनी ही पावर को लेके स्ट्रॉन्ग बिलीफ होता है उनको कि दैट आई एम वेरी स्पेशल एंड यूनिक, राइट. उनको हमेशा ही प्रेज की नीड है, उनको हमेशा ही एडमायरेशन की नीड है. दे ऑलवेज वांट टू बी एंटाइटल्ड wherever they go, whatever they do. एंड उनका एक पैटर्न ऑफ एक्सप्लॉयटेशन है लोगों को फॉर देयर ओन पर्सनल गेन. सो बी अवेयर फ्रॉम दैट सॉर्ट ऑफ पीपल. उनको कोई एम्पैथी नहीं होती है. दे ऑलवेज कीप ऑन jealous from people and they distrust people at all. So that is how they are very harmful for other people as well. They are very arrogant, superior, and they disrespect everyone around. So these are the symptoms of narcissist personality, who are self-focused, or you can say very preoccupied to be enjoying their own success, their own power, right? So moving on to the another type, which is the another category, the last category in which I'm going to take up with the first type, which is, so when we talk about anxious personality disorder, that is a disorder often we wherein we feel or see that the person is very fearful and nervous. Why? Because if you remember that in the anxiety disorder dialogue series, I shared with you that anxious, disorder, when somebody is experiencing anxiousness, that is related to their fears. There are certain things through which they have fears. Either they have social anxiety, they have a phobia or a situation where they get or tend to feel nervous from a particular thing, place, object. So here when we are talking about anxious personality, they remain very anxious about certain things, and there are certain types which I'm going to talk about. First is avoidant personality. So when we are talking about the avoidant personality, so here, basically, the avoidant itself explains a lot, that they avoid people, they avoid social gathering, they avoid social situations, the social circumstances, and they, because of they have the anxiousness, they have the embarrassment, they have the fear attached to it that people might judge them, and that is what they fear. They don't want to get along with people, so that they might not be judged by anyone and they can feel comfortable. So they often miss out on many valuable social experiences because of their fear. They don't want to go among people. They don't want to really be seeing people in any which ways. Okay. And they don't want anyone to be rejecting them. So what are the symptoms? They need, to be well liked every time, wherever they go. Everyone, हर इंसान को उनको like करना चाहिए. They think that everyone should be really accepting them for who they are, even if they have some, uh, disorder in them, and even if what sort of personality they are. Or the next, we can say that lack of pleasure in activities. This is another symptom, that they don't enjoy any activity. उनको कोई pleasure नहीं आता कुछ भी perform करने में, कुछ भी करने में. Anxiety रहता है उनको, about saying anything. So, or even of doing anything. Why? Because जब भी उन्हें कुछ कहना है, how people are going to take them, how people are going to judge them, this is the fear they have. So इसीलिए वो कुछ कह नहीं पाते और वो anxious रहते हैं, और वो कुछ करने से भी डरते हैं. उनको social situation से भी anxiety रहता है. They avoid conflicts. तो इसीलिए they become people pleaser. They try or tend to please everyone around them so that they can fit into the society. And they avoid interactions, in work setting. Or why? Because they think that people might will judge them in the work setup. उनका कोई growth को रोक ना ले, या people might not pull them down. So this is what they always remain fearful for. And they avoid intimate relationship. इवन की इंटीमेट फीलिंग्स को भी वो शेयर नहीं कर पाते. वो अवॉइड करते हैं बिग और स्मॉल डिसीजंस को लेना. एंड वो सिचुएशंस को भी अवॉइड करते हैं, क्योंकि उनको फियर ऑफ रिजेक्शन होता है कि कभी हमने कोई भी सिचुएशन में कुछ किया, so people might not reject them. So they avoid the social situations or events also for the same reason, because they have a fear of rejection. They remain anxious for this thing. So they avoid, they easily get hurt when somebody will criticize them or disapprove them. They become totally shattered at that time. उनको extreme self consciousness होती है. So these are the symptoms of avoidant personality disorder. Continued with the more symptoms, उनको failure होता है intimate, to initiate the social contact. किसी से भी, anyone in the society, in the community, they can't talk well. So they have this fear. They really feel fearful that people, how they are going to judge or how they are going to take them. So they can't initiate any talk. So उनको fear है कि लोग उनको pull down भी कर सकते हैं, और कि as if they are inadequate to be doing anything. वो hyper sensitive लोग होते हैं, very hypersensitive to negative evaluation. If somebody criticize them or evaluate them, or let's say they are in a working space where for some reason उनको बताया गया कि उनका काम अच्छा नहीं है, so वो एक negative evaluation होगी उनके against. So they become very hypersensitive for these things. उनमें confidence की कमी होती है, उनमें trust लोगों को करने की कमी है, उनमें बहुत कम self esteem है, लोगों को मिस इंटरप्रेट करते हैं, सिचुएशंस को मिस इंटरप्रेट करते हैं, कोई उनके क्लोज फ्रेंड्स नहीं होते, सेल्फ आइसोलेटेड ही रहते हैं, सोशल शाइनेस बहुत है उनमें, क्योंकि उनको फियर है बहुत ज़्यादा लोगों से बात करने का. मे बी दे विल नॉट लाइक देम, or they will reject them, or there are certain fears they have. That is how they have this social shyness, right? वो unwilling है to take any new, uh, to take any new risk in life, or to try something new in their life, any adventure or anything, something they have to try out new. If there's a new thing introducing into their life, they fear to do that, thinking of the consequence, that what if it won't go well according to maybe other people's expectations. So वो अपने आप को सोशली बहुत ही इंफीरियर समझते हैं, विजिलेंट रहते हैं रिजेक्शन को लेके, ठीक है, और लोग उनको रिजेक्ट तो नहीं करने वाले, उनके एक्शंस को देखते हैं, ठीक है. सो दीज आर द सिम्टम्स, these are the symptoms of avoidant personality disorder. Moving on to the next type, which is dependent personality disorder. Dependent itself says a lot. Dependent sort of a personality who remains dependent on other people, who need constant reassurance from others, feelings in which the person continuously feel helpless, inability to make any decisions, because they rely on other people. They are not dependent, self-dependent. They are very, very dependent on other people. They want approvals, they want others to help them, to have their acknowledgement, and they are dependent personality. And very, they become very close to other people, and they spend great efforts to be pleasing people, trying to be really letting them to accept them, right? So they are very much dependent sort of nature they have. They tend to display very passive behavior, और sometimes इतने क्लिंगी हो जाएंगे कि दूसरे पर्सन को उनसे बहुत इरिटेशन लगेगा कि that this person is so clingy and not leaving me alone. And उनको क्यों वो क्लिंगी हो जाते हैं, क्योंकि उनको फियर है कि लोग उनसे सेपरेट ना हो जाए, उनको छोड़ ना दें और उनको डिसलाइक ना करें. So that is why they try to keep on holding relationships, so they become very clingy at the same time. So talking about dependent personality disorder symptoms, they are there is avoidance of personal responsibility. उनको अपनी responsibility लेना भी avoid करते हैं. बहुत ही difficult situation में आ जाते हैं जब वो अकेले होते हैं. उनको बहुत ज़्यादा rejection का और fear है कि कोई उनको छोड़ ना दे, abandon ना कर ले. उसके लिए वो बहुत helpless feel करते हैं, और उनकी रिलेशनशिप्स इसीलिए चल नहीं पाती हैं. बहुत ही ओवर सेंसिटिव होते हैं टुवर्ड्स एनी सॉर्ट ऑफ क्रिटिसिज्म. दे बिकम वेरी वेरी अनकंफर्टेबल इफ समबडी क्रिटिसाइज टू देम, and they have lot of doubts. They lack self confidence उनमें है ही नहीं, क्योंकि जिनको fear है लोगों का, जिनको fear है that people might not reject me, abandon me, leave me, how they are going to take me, so definitely उनका कॉन्फिडेंस लेवल बहुत ही कम होता है. सो उनको ट्रबल रहती है एवरी डे के डिसीजंस, लिटिल लिटिल डिसीजंस, डे टू डे लाइफ के डिसीजंस लेने में भी दे फील वेरी कॉम्प्लिकेटेड. And moving on to the last type, which is obsessive compulsive personality disorder. OCD, you might have heard, which is obsessive compulsive disorder. Now, here we are talking about obsessive compulsive personality disorder. So, imagine when somebody is experiencing this kind of a personality disorder, तो उनको क्या मतलब कैसे हम जान पाते हैं ऐसे लोगों को? उनका जो पैटर्न है वो बहुत ही परफेक्शनिस्ट होते हैं. दे actually tend to be a, they need perfectionism in everything. They don't like inflexibility. They have a routine kind of a thing. They are very very they focus on a pattern or in their life for everything. They want to control everything. There has to be a order in everything. There has to be a system. There has to be a very symmetrical things. So there are these things which they strongly focus on, and they fear of doing any mistakes while performing all of these things, or when they go out of their pattern of what I explained. So if they go out of it, they really remain fearful. So this fear जो है वो हमेशा उनके डिसीजन मेकिंग में के बीच में आता है, डिफिकल्ट कर देता है उनके टास्क को फिनिश करने में, और उनको हमेशा प्री ऑक्यूपाइड रखता है डिटेलिंग्स में. अब डिटेलिंग्स की अगर हम बात करते हैं तो सपोजिंगली when somebody has a OCD for let's say symmetry, right? When they want things into a very symmetrical order, so they keep on looking into the peculiarity, the detailed thing, that if this thing is in the symmetry, even the half inches of here and there will not be acceptable. तो उनको बिल्कुल चाहिए कि हर चीज ऑर्डर में रहे, सिमेट्री में रहे. जरा सा भी हिल भी जाएगा तो वो एक्सेप्ट नहीं करेंगे. सो उसके चीज में कि वैसा कोई मिस्टेक ना हो जाए, उस वजह से उनको बहुत सारी एंशियसनेस रहती है, फियर रहता है. ठीक है. सो टॉकिंग अबाउट द सिम्टम्स, अब कैसे पता चलेगा कि किसी को ओसीपी डिसऑर्डर है? सो हाउ वी कैन गेट टू नो? So here we go about it. So when we talk about the obsessive compulsive personality disorder, उसमें preoccupation रहेगा person का into the details of the thing, listing of the thing, orderliness, rules, procedures, schedules. They keep on shaking up their mind into all of these things. इन चीजों से उनका माइंड हट नहीं सकता. उनको परफेक्शन चाहिए, इतने स्ट्रिक्ट है अपनी परफेक्शन को लेके कि एवरीथिंग हैज टू बी परफेक्ट. सो उसमें ही इतना रहेंगे कि वो उनको टास्क कंप्लीशन नहीं हो पाती, क्योंकि व्हेन यू आर सो मच फोकस्ड ऑन समथिंग, फोकस्ड होना इज गुड, बट व्हेन यू आर सो मच पिक्यूलर अबाउट every bit and corner of the thing, so how will you finish the task? So your focus has to be on finishing the task as well as on the perfection. Both of the things go together, right? And next उनका symptom है कि excessive devotion है उनका टू वर्क के लिए, किसी भी काम को लेके इतना एक्सेसिव डिवोशन है. दे आर मेंटली सो इन्वॉल्व इन दैट कि उनका काम फिनिश नहीं हो पाता है. वो इंटरफेयर करता है उनके सोशल और पर्सनल एक्टिविटीज में. हमेशा अनविलिंग रहते हैं टू डेलीगेट टास्क टू अदर पीपल, क्योंकि उनको परफेक्शन चाहिए. तो उनको लगता है कि दूसरा पर्सन इतना परफेक्ट काम करके नहीं दे सकता. सो दे डोंट डेलीगेट देयर वर्क टू एनीवन एल्स. So they are extremely miser people. They are strict, devotion to moral and ethical codes. As I told you that they are very perfectionist. तो उनको हर एक चीज ethical values, rules, regulations और perfection के हिसाब से चाहिए. Overwhelming need है उनका for order and environmental control. जब उनके environment और जब जिस way से orderly sequence में they are doing the work, if that is not happening this way, वो ओवरवेल्म भी हो जाते हैं. एक्सेसिव अटेंशन रहता है उनका डिटेल्स में, राइट? एक्सेसिव प्री ऑक्यूपेशन रहता है उनका पंक्चुअलिटी में. होर्डिंग जो है दैट इज ऑल्सो देयर इन देयर लाइफ. जो चीजें यूजफुल नहीं है, यूजलेस है लाइफ में, जिसका कोई उनका मीनिंग भी नहीं है घर पे, ऑफिस में या कहीं पे भी पड़े रहने का, दे कीप ऑन होर्डिंग टू दोज थिंग्स. दे कांट लीव थिंग्स वेरी इजीली. So these are the types which I shared. I hope you had a broader perspective of the personality disorder. So I'm happy that I was able to share all of these things. You are well aware of what is a personality disorder. You have had the elaborative explanation of each type. Fine. So moving on to now, I'll be sharing with you a case, and at the end I'll share the interventions. Okay. So now I'll be talking about the case wherein I would like to tell you that there was this couple, and basically the this female who reached out to me, and who was very uncomfortable in life, not sure about what is happening, and unhappy because whatever the husband was doing, this is something was very very torturing to her, very very unacceptable. She was not happy for why is he doing all of what he is doing. But basically this person was experiencing a very severe thing, which was a personality disorder. So okay, talking about this case in which this lady was disturbed. She was really not understanding that why is this happening, why the husband is so you know dramatic attention seeker, wherein the husband want all the attention, and everyone in the family was disturbed because of it. Even the children were disturbed that why the father is behaving this way, which is not so appropriate. So when she explained all the things to me, I was able to understand a bit, but I asked her to please bring your husband, because that is what will give me more clarity that what exactly is the situation. So I was able to talk to the husband, and that's when I discovered that the person was really experiencing a personality disorder, in that he was experiencing the particular type which was histronic or melodramatic personality disorder. So this was his personality disorder, due to which he was a very attention seeker, melodramatic person. He wanted to act differently. He wanted to do things which were not appropriate, maybe by the other people, right? And he was doing things which even the family was not being able to understand. So here, what I understood was that firstly, before we shall start with any intervention with this man, importantly the family has to be psychoeducated. So I tried explaining the things to the wife so that she can understand and adjust well with the person, give him the space, who is already experiencing a mental health disorder which is not easy for him. So whatever he is doing is something that is not in his control, not in his hand, right? So he was doing things out of something uh, which he was going through, which is not a happy or a very good experience, right? So the lady needs to understand that this is a problem he has been experiencing. It is not deliberately he's doing all of that. When I explained all of these things to her, also I conveyed her to convey the same thing to the other family members, even to the children, to cooperate with this person first, because this person already is going through a lot, right? So if the family will not support, so there is a chances that he will become more ill, more sick. So this was the thing that I had to tell you. And I want to tell you that after when I spoke to this person, I started with the intervention. The intervention started, and everything went well. And with number of sessions, and with number of sessions, things were improving in his life, and he is still under the treatment, and things are going on. And I want to tell you that this is a thing which every kind of a personality disorder is a serious affair that need the family to understand, also that need a professional's attention. So if you think that there is something going on for a longer time period, you need to seek out for professional help. This will help sort down not only the trouble what the person is experiencing, not only the intervention will be given to the person separately, but also this will help the family to create a beautiful space for that person who is a patient, right? Who need this love and support, and who need the family at least to be accepting and not leaving him or her, right? So this is what is the case, and wherein the only I can say the important point is that if somebody's closed ones or loved ones are experiencing anything, you need to show some love and respect and patience towards a person. And maybe what you can do is seek out professional help for them so that they can easily come out of, or their when their treatment or intervention will be started, their symptoms will be reduced and they can well adjust to the family again, and you can have or enjoy the happy life. So moving on to the intervention part. So when we talk about intervention part, and especially when I am talking about the personality disorder, very importantly, I want to mention that every person shows different results for the different or variation of therapeutic sessions that we give, to every person. So this is different. The results are definitely different in every person. So when I have to tell you the basic foundational approach that I mentioned in every of my episode, I would like to mention here as well. It starts from the case intake. So case intake is followed by the counseling, because when we continue it with the counseling session, that is when we can gather a lot of information, and that is how our case intake is completed, and that is then followed by a psychological assessment. Once we have the case details, so we need to assess what we have suspected the person is experiencing. So we need to assess, and that is what will give us the direction, that what is the intensity, how much the person is experiencing it. Is it a very low level, is it adjustable level, or is it moderate, or is it a severe case? We need to start our intervention knowing through what the stage of the person, right? And after the assessment we make a psychological diagnosis. When the psychological diagnosis is being formulated, that's when the intervention can be started. So now that you know what the situation is, what the person is experiencing, what is the intensity, you plan accordingly that what sort of treatment will be suitable for the person. So now, when I'm talking about the personality disorder, I usually start with CBT, which is a cognitive behavioral therapy, which is a combination of behavioral, cognitive, and behavioral therapy, wherein we actually work on the distorted, the disbeliefs of the person that needs to be, converted in some positive way, in which the person can eliminate their irregular thoughts, something that is not entertaining them, or anything that is making their personality go very peculiar or really not good. So, or I'm talking about the personality disorder here. So when somebody have a personality type, any type, so there are there are personal beliefs as well. The person tend to form in their mind. ठीक है, जो वो दिमाग में बन जाते हैं, उन belief system के साथ हमें इस तरह से उसको मॉडिफाई करना है, सो दैट द पर्सन कैन फील गुड अबाउट इट, right? And not only that, secondly is that DBT is also a very powerful tool here, the therapeutic session, through which what we do is that when we use CBT, it is a way where the limited pattern of thinking or the distorted thinking is being converted into the positive behavior. And now, when I'm talking about DBT, which is a dialectical behavioral therapy, in which we basically teach the person for how to deal with different things, right? In the sense, what I can say is that लाइफ स्किल्स सिखाए जाते हैं, माइंडफुलनेस सिखाई जाती है, इमोशनल रेगुलेशंस, दैट इफ द पर्सन इज एक्सपीरियंसिंग इमोशनल issues, how to regulate those emotional emotions, how to channelize those emotions. If somebody is getting depressed, sad, how to regulate those particular emotions. And secondly, it is important for the person to understand that there is a limit of tolerating anything. So we teach that how to tolerate certain things, and what is a better way to be to be actually, you can say, how to learn accepting certain things which is not pleasant. So वो सब सिखाते हैं DBT में, which is a dialectical behavioral therapy, wherein certain dialogues are being exchanged, in which by exchanging the dialogue, the person who is a client or the patient understands certain things in a very bigger or broad perspective, so that they understand and get ready to change or modify their behavior into a positive behavior. And next is EFT, which is another powerful tool. And I want to tell you that EFT is a very powerful tool, works in every kind of a mental health disorder. So, talking about EFT, this is the tapping sequence that we use for the pent up energies, pent up emotions, all that is being very disturbing to the client, to the patient, that we work upon so that they can live a happy and sound, a very well mentally sound life. Okay. So, moving on, not only all of these things, when somebody is experiencing personality disorder, it's important to psychoeducate, right? Now, here the psychoeducation is done for the client, for the patient, definitely, because until and unless client will not be well aware of what he or she is experiencing, हमें उसको बताना जरूरी है कि आप क्या लाइफ में एक्सपीरियंस कर रहे हो, क्यों कर रहे हो, क्योंकि आपको ये डिसऑर्डर है, क्योंकि ये सारे जो भी आपके साथ चीजें हो रही हैं वो उसका रीजन क्या है. जब हम ये चीज एक्सप्लेन कर देते हैं, साइको एजुकेट करते हैं उस पर्सन को, दैट्स व्हेन दे स्टार्ट टू अंडरस्टैंड देमसेल्फ. वो अपने आप को अच्छे से एक्सेप्ट कर सकते हैं. जब वो अपने आप को अच्छे से एक्सेप्ट कर सकते हैं तो ही वो दूसरों की समझ सकते हैं, मे बी वी लेट्स से फैमिली एंड फ्रेंड्स, कि व्हाई दे आर सो अपसेट विद देम, व्हाई दे आर नॉट बीइंग वेरी यू नो द वे दे वांट टू बी विद देम, वो उनके साथ वैसा क्यों नहीं रह पा रहे. सो फर्स्ट वो अपनी प्रॉब्लम के बारे में जब समझ जाएंगे, वो लोगों को समझना स्टार्ट करेंगे. और साइको एजुकेशन इज नॉट restricted just to the patient. It is important to psychoeducate the family as well, and if possible friends as well. So moving on to psychoeducating the family as well. Why? Because they have to understand that the patient, their family member is already experiencing something which is very unpleasant, not so happy. तो वो तो जो एक्सपीरियंस कर रहा है. नाउ इट इज इम्पोर्टेंट फॉर समवन टू बी अंडरस्टैंडिंग हु आर देयर क्लोज वंस, हु आर देयर फैमिली. जब वो इस चीज को समझ पाएंगे, वो उसको एक ऐसा स्पेस दे पाएंगे घर में जिससे कि वो एक्सेप्ट कर पाएंगे हर चीज को, और वो पर्सन भी हैप्पी रह सकेगा और उसको हीलिंग के लिए कम टाइम लगेगा. So it is very important to psychoeducate the family at the same time, and at the same time maintaining a safe environment at home, at wherever the client or the patient is. ठीक है. सो साइको एजुकेशन इसीलिए इम्पोर्टेंट है कि एक सेफ एनवायरनमेंट क्रिएट किया जाए द पेशेंट के लिए, सो दैट वो हैप्पी हेल्थी वे से हील हो पाए, उसको राइट टाइम पे इंटरवेंशन मिल जाए, और उसको एक हैप्पी एनवायरनमेंट मिलेगा तो वो अपने आप को भी समझ पाएगा. ठीक है. And these are the steps that we follow, the interventions that we give when somebody is experiencing personality disorder. But when somebody is experiencing a severe level of personality disorder, where the case is very severe, then at that point of time, medications are involved. So this is what the intervention process is, and now I'm just, and I have ended up explaining all about the personality disorder. Hope you have had the great clarity and you really are taking away something today. The very in this very special episode, you must have learned something about personality disorder. So those who have missed the opportunity to be seen live, so it will be streamed very soon in Facebook and in my other social media platforms. So you can definitely check on any time when you find time. So all right, now it's my time to say goodbye. Before I shall leave, I am sharing my details. If you want to connect with me, on the screen you can see my official profiles, starting on with the website, and you can email me as well, and I'm available in LinkedIn, Facebook, Instagram, Twitter. I have a channel in YouTube that is with the self-help tips. You can go explore, check there with the name Good Mental Health by psychologist Anuradha. Also, I'm running a podcast channel that is with Good Mental Health podcast series. You can check this out and listen to the podcast. So, hope you had a great time listening to me, and I shall see you in my next episode that will be DD6 very soon coming up. And till then, you guys have a blissful days, have the good time, and enjoy your life. So, closing the live for today. See you next time. Take care.